Today, let's compare type 1 diabetes with type 2 diabetes. First, let's look at the pathology. Now, the pathology of type 1 diabetes is that there's no insulin production. You can remember this by the memory trick. Type 1, we have none. It is also caused by an autoimmune response. Here the cells are starved of glucose since there is no insulin to bring glucose into the cells. The cells break down proteins and fats into energy, causing ketones to build up. This buildup can lead to diabetic ketoacidosis. Type 2 diabetes can be caused by a few things. The body doesn't produce enough insulin. The body produces insulin that doesn't work properly, or the insulin receptors are worn out. So you can remember this by the memory trick. Type 2, think technical difficulty. Now let's look at the onset. The onset of type 1 diabetes is very abrupt. Now, not always, but this is most commonly diagnosed in childhood, where type 2 diabetes has a gradual onset and is typically diagnosed in adulthood. You can remember this by the memory trick. Childhood comes first in life, second adulthood comes second. Now let's see the risk factors. In type 1 diabetes, genetics, family history, and in type 2 diabetes, high blood sugar, obesity, hypertension, inactivity, high cholesterol, smoking, family history. Now let's see the signs and symptoms. Here remember 3 P's. Polyphagia, excessive hunger. Polydipsia, excessive thirst. Polyuria, excessive urination. Now let's look at the treatment. Type 1 diabetes patients are insulin dependent for life. So, type 1, think they have one treatment, which is insulin. Where type 2 diabetes has 2 or more treatments, things as diet and exercise, oral hypoglycemic agents like metformin, and possibly insulin. Don't forget to subscribe for more.